Barriers to obtaining a good quality ECG. Obtaining an accurate, good quality ECG with a sharp, flat baseline and distinct waveforms is crucial for enabling correct interpretation. Barriers to achieving this include inaccurately placed electrodes or leads, electrical interference from other devices, skeletal muscle activity, and poor conduction of the current somewhere along its path from the skin to the monitor. Electrode or lead misplacement is a common problem which can cause profound changes to the shape of the waveforms, leading to significant errors in diagnosis. For this reason, we've spent a lot of time in week 1 looking at the correct location of the electrodes and attachment of the leads. An example of a very common mistake is reversal of the left and the right arm leads, so that the left arm lead is placed on the right arm and vice versa. If we look at the waveforms on a normal ECG, you can see that they are predominantly upright in lead 2 and pointing downwards in AVR. However, when the left and right arm leads are switched, the waveform directions in this example are reversed. To help avoid this kind of error, it is good practice to check for the normal predominantly upright waveforms in lead 2 and downwards facing waveforms in AVR immediately following the procedure. Electrical interference can be due to alternating current which supplies electrical wall outlets. This can be caused by electrical wires in the walls and other equipment in the room, and is identified on an ECG as a thick, fuzzy baseline. Ways of addressing this include unplugging equipment which is not in continuous use, or moving the ECG and the patient away from the equipment. Skeletal muscles also generate electrical impulses which can be detected by an ECG. Causes include muscle tension, which may arise when someone is not relaxed or comfortably positioned, or muscle tremor from, for example, shivering, anxiety, or a condition such as Parkinson's disease. Movement of the patient on the bed or talking can also cause this problem. The muscle activity is represented on the ECG as a bumpy or spiky baseline. To minimize the issue, it's important the patient feels warm, comfortable and relaxed, and they are asked to remain as still as possible and not to speak during the procedure. A wandering baseline is undulating rather than flat, making the ECG difficult to interpret. It is linked to the movement of the chest wall during breathing, but can also have other causes such as poor skin to electrode contact. In stable patients, asking the person to hold their breath during the procedure may be helpful. Poor conduction of the electrical signal is a frequent problem which can arise due to inadequate skin preparation, which is necessary to remove oils, sweat, hair, and build-up of dead cells from the skin to facilitate a good skin-to-electrode contact. Dry electrodes, which may have reached their expiry date, been inappropriately stored, or been left on the body for a period of time, may also not have enough gel to provide a good contact. Other possible causes of poor conduction are tension on the cables, which may cause the electrodes to peel off the skin, and breaks or cracks in the cable or lead wires. Where conduction from the skin to the monitor has not taken place, you will see a missing lead with just a dotted baseline as shown on the screen. Strategies for ensuring good conduction, including skin preparation, have been explained in week 1.